into two major groups: the extrinsic back muscles and intrinsic back muscles. The intrinsic back muscles. The extrinsic back muscles, which is further segmented into superficial and the intermediate one. Superficial and intermediate ones. That means when you are saying the superficial muscles, they are 5 in number and they act on the upper limbs. They controls and create a movement on the upper limb. Whereas the intermediate muscles, they are small muscles, they are 2 in number, and they are called respiratory muscles. They are respiratory muscles. Whereas the deep one, or which is called intrinsic one, the intrinsic one, those muscles are they act on the vertebral columns, and producing movement and maintain postures. So those muscles, the deeper one, it is also called the proper back muscles. Because it acts on the vertebral columns and maintain the postures of vertebral columns. Whereas the superficial and intermediate groups of the back muscles, they act on the upper extremity and on the ribs. That means that controls the volumes of thoracic cavity. That's help for inspirations. Let's see those muscles. Those are the superficial muscles. You see, this is the trapezius muscles, half of it from the middle, and the latissimus muscles, which is the two superficial ones, and somewhat from the other side there is rhomboid minor and major ones. And there is also levator scapulae, which forms the superficial one, the superficial group. And the intermediate ones, which is the serratus posterior superior and the serratus posterior inferior muscles, which is stomach-like muscles, and they are called respiratory muscles. Still, they are segmented as extrinsic muscles. And which is innervated by the anterior rami, of the spinal nerve except trapezius muscles. This trapezius muscles is innervated by the cranial nerve 11, which is the accessory one, the accessory cranial nerve. But in the case of deep back muscles, they are generally innervated by the posterior rami, of spinal nerve. But here, which is innervated by either by anterior or cranial. And it is also called the superficial ones, which is also called 𝒖💔𝒄𝒌 muscles, the posterior 𝒖💔𝒄𝒌 muscle, because which act on the girdles and upper extremity as well, but they connect the two parts of our body. That means the trunk and the extremity. And those muscles are included the trapezius, latissimus dorsi, and levator scapulae, and there is also rhomboid and major. They are 5 in number. And as I was saying before, their innervation by anterior rami of spinal nerve, except the trapezius muscles. This one is the trapezius muscles. As the name it tells, which is quadrangular muscle, that is seems like a trapezius. This one is half of the trapezius muscle, one half of the trapezius muscles, and from the other side there is a trapezius muscle. So they gives a trapezius. The two muscles they gives the trapezius. So that is why it is called trapezius muscle. And this one is latissimus dorsi muscles. Let's see those muscles one by one. the trapezius ones, which is large and triangular muscles, which cover the posterior aspects of the back. That means the neck and the trunk, superior parts of the trunk, and which attach on the pectoral girdle, on the pectoral girdles of the craniums and the vertebral columns. The fibers are, there are three fibers. Let's see here. This one is the descending fibers, or which is the superior fibers. The superior fibers, which is inserted from, originated from the superior nuchal lines and towards the superior nuchal line, as well as the mastoid process, up to the mastoid process. And there is also transverse one. The transverse one, this one is the internal ones. This one, the transverse. And there is also the inferior ones, which is ascending fibers. The ascending fibers. And they insert to the lateral one side of the clavicles. You see this one? They insert on the lateral one side of the clavicles. And the spinous process, the acromion and the spinous process. Those are the sites where the trapezius muscles are inserted, but which originated from the nuchal ligament, which extends from the external occipital protuberance to the C7, spinous process of C7. Then starting from C7, which the trapezius muscles is originated from the spinous process of the vertebrae up to T12, okay? And they insert to the spines of scapula, acromial process, and on the lateral thirds of the scapula. By the way, this attachment is also used to guess the actions of those muscles. For instance, the medial one, which was to retract the scapula or pulling the scapula medially. Whereas the superior one, or the descending fiber, which was to elevate the scapula, Whereas the inferior one, which is to depress the scapula, Then, unlike that of the back and superficial back muscles, which is innervated by the accessory nerve, which is innervated by the cranial accessory nerve, which is cranial nerve 11, which is called accessory nerve. Okay, organs, the medial side of the superior nuchal lines and external occipital protuberance, the nuchal ligament and spinous process of C7 up to T12, which gives an origin and which is inserted on the lateral side of clavicles and acromion, as well as spinous process of scapula. You know, the action, the descending fiber, that means the superior part. This one is the superior part. The ascending fiber, this one is the inferior part, whereas the middle part, which is the transverse fibers, which has transverse fibers that retract the scapula. That's the scapula. Whereas the descending part, which elevates, and the ascending fiber or part, which depress. And collectively, the descending one, which act on the gluteal cavity and rotate superiorly. Now the latissimus dorsi muscles, which is the widest muscles. Latissimus means it is widest. Dorsi means back. So, which is the broadest or widest muscles, and which is a fan shaper, which run from the axial to the upper extremity. That means the intertubercles of the humerus. which act with the pectoralis major and which is the powerful adductors of the humerus, and which is also commonly called clamping muscles, the clamping muscle, because when you are clamping the tree, which rise the body, the trunk to the arm, so it is called clamping muscles, which is commonly called the clamping muscles. So, which 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 originated from the iliac crasier, the sacrums, some parts of the sacrum, and this one is the thoracolumbar fascia, as well as the spinous process of the inferior six vertebra, That means starting from T7s, the spinous process of T7s, they originate, and some parts of on the angles of the ribs, the inferior ribs. So which rounds the trunk and turn back to and insert on the grooves, intertubercular grooves, a group between the two tubercles of the humerus, which is innervated by the thoracodorsal nerve, which is the thoracodorsal nerve. Mind you, this thoracodorsal nerve is a branch of the anterior rami of spinal nerve, which is originated from the brachial plexus. As you have seen before, the back, the superficial and the intermediate, which is innervated by the anterior rami, Therefore, this nerve, which is arise from the anterior rami of spinal nerve through the brachial plexus, finally the brachial plexus, which gives a branch of thoracodorsal nerve. They are arise from the cervical vertebrae, the cervical nerve C6, C7, and C8. Okay, so it inserts with groups, that means the intertubercular groups, and they extend, adduct, and medially rotate the humerus, and they raise the body towards the arm during clamping, so it is called clamping muscles. The other muscle is the levator scapulae, as the name it tells, which is elevators of the scapulae, which pull superiorly the scapula. Which is found deep to the sternocleidomastoid muscle and the trapezius muscle. Sorry, uh, which is arise from the posterior tubercles of the transverse process of C1 up to C2. I think it is better to see on the picture. Here it is. This one is the origins of the spinous process, which is originated from that transfer process of C1 and C2 up to C2. I mean up to C4. You know, the transverse process of spinous process, the transverse process of cervical vertebrae, which has tubercles, the anterior tubercles and the posterior tubercle. So these muscles originated from the posterior tubercles of spinous process, and which insert on the angle up to the levels of spinous process on its medial surface, medial borders of the scapula, So it elevates the scapula. The other muscles, which is rhomboid muscles, there is minor and major ones, as the name it tells, which is rhomboid in their appearance, which is still linked to the trapezius, and they are run from the vertebral columns to the medial borders of the scapula, and they are serve as retracting the scapula. The minor one, which is found superiorly, and which is originated from the lucal ligament and spinous process of C7 and T1. Whereas the major ones, which is arise from T2 up to T7s of spinous process. And their insertions, which is inserted on medial border. Both of them are inserted on the medial border of the scapula. You see, those are the insertion site, whereas this is the origin site. The origin site is somewhat fixed, whereas the insertion one is which is allow movability when the muscles are contract. So during contraction, the scapulas are retract or moves to the medial borders of the body. Look, this one is a minor one, which is found superiorly and which is inserted on the superior part of the medial border of the scapula until the levels of the spine. And inferior to it, up to the inferior angles of the scapula, the rhomboid majors are inserted here. And both of them are innervated by dorsal scapular nerve. This one is a plexus, a branch that arises from the brachial plexus. Now the rhomboid major one, which is thinner and more wider, whereas the rhomboid minor one, which is thicker ones. And both of them they retract the scapula and fix the scapula to the thoracic wall. And which rotate the glenoid cavity, or into the depressed one. Look, when you are retracting, these parts of the scapula will be moved upward, whereas this one, the glenoid, which becomes depressed. This one is rotational movement at depressed, rotation towards the depressed one, not depression, rather depressed. Okay. So those are the muscles that is found on the superficial layers. There is a muscular triangles. On that is easily perceived over the skin, because there is no muscular covering. By the superficial back muscles. This one is the auscultation triangle. Which is used to hear the sounds of the lung by stethoscope, which is formed by the trapezius, there is scapula, and latissimus dorsi. This one is inferior border, which is, this one is the inferior, and this one is the lateral, and this one is the medial one. The inferior border, which is formed by the superior borders of the latissimus dorsi muscles. This one is the latissimus dorsi muscles, whereas the inferior lateral or the lateral borders of the trapezius muscle, which forms the medial border. Whereas the lateral border, which is formed by the medial border of the scapula, the bone itself. And the rhomboid major muscles, which forms the floor. You see, the rhomboid major muscles which is a thin muscles. Therefore, it can allows to hear the sound at this point, the sounds of the lung when you are breathing. Now the other triangles, which is the lumbar triangles. Of course, these triangles, which is not as such important for clinically, rather, which is aside for the abdominal herniations are occur. Abdominal herniation. Herniation means protrusions of visceral organ. In this case, abdominal visceral organ may be prolapsed or herniated to these lumbar triangles. And these lumbar triangles, the structure that participates is two muscles, the latissimus dorsi muscles, as well as the external oblique muscles. And the inferior ones, which is formed by the iliac crust, and the floor, which is formed by the internal oblique muscles. You see, look here. Here it is the triangles. The triangles. This one is the lattice dorsi muscles. The lattice dorsi muscles, which is the posterior one, and the anterior one, which is external oblique muscle, and inferior one, which is the iliac crust. This one is the iliac crust, which is a bone. Therefore, this one is the weak area where the abdominal visceral organs are protruted, and my pulses also accumulate over this area. Now let's continue to the musculatures. We have seen about the superficial muscles of the back. Now let's continue to the intermediate one. Still, this intermediate one is the extrinsic back muscles. Which is not a proper back muscles. They are two in number. And they are used for respiratory or respiration generally, which are the serratus posterior superior and serratus posterior inferior muscles, the inferior muscles. Look, this one is the serratus posterior superior, which is deep to the rhomboid muscles, and this one is the inferior one, which is still deep to the lattice dorsi muscles. Look, this ones, which is used to depress the ribs. You see, the ribs, used to depress the ribs. Whereas this one is the superior ones, which used to elevate the ribs. During contractions of, those muscles, ribs, they know the diaphragm, which is partitioned the abdominal cavity and the thoracic cavity, and which is highly participate on breathing, which is a dumb shape in their structure. Therefore, to prevent a pulling actions of the diaphragm, this muscles is contributed opposing the actions of the diaphragm. So, which keeps the anteroposterior cavities of the thoracic cavities are larger, whereas this one is rise the ribs or elevate the ribs. The ribs are elevated while we are in respiration, while taking air towards the lung. So, which increase the thoracic cavity by elevating the ribs. So they are accessory, but they are contributed for respiration, and they are innervated by intercostal nerve. Those are the muscles. Those intermediate group muscles, and under it there is the proper back muscle, which is the deep group. Let's see now the group, deep one. Those are the action and where they are inserted and originated. You can see. Now let's continue to the intrinsic back muscles. These intrinsic back muscles, which is also called proper back muscle or deep back muscles, because which is acts on the vertebral column and to maintain the posture and create a movement on the vertebral column, and they are innervated by the posterior ramus of spinal. So these muscles, which extends from the pelvis to the cranium, along the vertebral columns, and which is enclosed by the fascia, thick fascia, which in this case the fascias are thoracolumbar fascia. Here it is the muscles. The erector spinae muscles, which is run from the hip bones, pelvic regions. That means the sacrum, which forms the posterior walls of the pelvic cavity, and which extends up to the base of the cranium, Now, before discussing the muscle, let's see the fascia. For general description, there is a skin, and under skin there is subcutaneous fascia, which is superficial, and deep to the superficial there is a deep fascia, But the names of the deep fascia, which is named, by the way, the deep fascias are named, but the names of the deep fascia differ from region to a region, or in other words, which is named by its region, But the deep fascia, the orientation is the same in all parts of our body. That means there is a skin, and there is subcutaneous fascia or superficial fascia, and which is followed by the deep fascia. Now, in the back regions, which has lateral and medial attachment. The medial attachment, which is, as the name it tells, at the midlines, which is attached at the midlines. For instance, on the nuchal ligament, on tips of spinous process of the vertebrae, the supraspinous ligament, and the median crest of the sacrum. Those structure is used for the attachments of those deep fascia. Laterally, which is attached on the transverse process, specifically on the lumbar and cervical, and angles of the ribs on the thoracic regions, This fascia is called thoracolumbar fascia. The thoracolumbar fascia. Here is the fascia. That's the fascia that is found in the thoracic end, and the lumbar region, which is the thoracolumbar fascia. You see, this fascia which is strong, and which is also used for the attachment, serve as an attachment of muscles. Let's see in the cross sections, of these muscles. These muscles has 3 layers from superficial to deep. Look, this one is the transverse sections of the trunk. This one is the vertebral calamus, this one is the posterior, and this one is the anterior one. So posteriorly, there is skin, under it there is cutaneous fascia and deep fascia. The deep fascia, which is the thoracolumbar fascia. The thoracolumbar fascia, which has 3 layers. The 3 layers, here it is the 3 layers. This one, and this one. Do you see the cursor? Is it visible? Okay, so this one represents the anterior one, which extends touch on the transverse process. Look, this one is the transverse process of the vertebra. Whereas the middle one, which attach on the tips of transverse process, Whereas the posterior one, which attach on the spinous process. This one is the spinous process. Then which used to partition the muscle into compartmentations. Look, these ones. In between the middle and the anterior, there is a muscle which is quadratus lumbarum muscle, which forms the posterior walls of the abdominal, which is not part of the back muscles. Whereas deep to the posterior layers of the thoracolumbar fascia, there is a deep back muscles. The deep back muscle, which is the proper deep back muscles. You see, therefore, which is covered by superficially by the posterior layer, and deeply, which is by middle layers of the thoracolumbar fascia. And this thoracolumbar fascia, as you have said before, is used for the attachments or origins of muscles. Look, this one. This one is thoracolumbar fascia. Where the fascias are the 3 layers are fused together and forms these ones, and gives for the origins of these muscles. That means this one is the transverse abdominis muscles, and this one is the internal oblique muscles. Those muscles forms the anterolateral walls of the abdominal wall. anterolateral walls of the abdominal cavity. Now let's continue to the muscles, which is the deep back muscles. The deep back muscles. Then this deep back muscles, this deep back muscle, which is also called intrinsic back muscles. Intrinsic deep back muscles. Intrinsic back muscles. These intrinsic muscles is also further divided into superficial, intermediate, and deep layers. Deep layers. Now, in the superficial layers, there is also only two muscles, which is found on the posterior parts of the neck, and which cover the deep neck muscles and serve as a bandage, And those used to hold the deep back muscle in position. These muscles are named as splenus cervicis and splenus capitis. The names of the muscles, which tells the superior attachment. The surfaces which attach on the cervical vertebrae, whereas the capitis, which is attached on the craniums. And the fibers which is extends supralaterally. Look, which extends from supralaterally, so which is commonly called a spinotransverse group. Look, this one is. Look, the fiber, which is the cervicis part, splenus cervicis, which is run from supralaterally, their fibers. Therefore, which is commonly called spinotransverse group. And this one is the splenus capitis muscle, which is inserted on the mastoid process. And which originated from the distal parts of nuchal ligament and spinous process C7 up to the five ones, ribs, spinous process of fives. These ones, the spinous process of 4, spinous process T4. Whereas this one is extends up to spinous process of T6, and which is inserted on the transverse process of C1, and it extends up to C3, or sometimes up to C4. Therefore, which serve as a bandage. There is also a lot of deep neck muscle under it, of course, which is not visible here. The other muscles are removed. But there is a deep muscle under it, and which is serve as a bandage. And which is innervated by posterior rami of spinal nerve. Now let's see the other groups of muscles, which is the intermediate one. The intermediate group. The intermediate group, which is also called sacrospinal group. The sacrospinal group. Yes. Hello. This ሙት ያላደረጋችሁ ይሰማችኋል? ኦኬ፣ መልሶ የኔን ድምጽ እየሰማሁት ነው። ለእናንተ እንደዛ የሚረብሽ ድምጽ አለው እንዴ? ያለው በእምነት
እመቤት እንትን ስላላረገች ኤርፎን ስላላረገች ነው ድምጽህ የሚያስተጋባው። ለኛም እየተሰማን ነው። አሁን ግን አቁሟል።
እመቤት
ነበረ በቃ አይ ኤርፎን ስላወጣች ይመስለኛል ስፒኪንግ ይል ነበር። አሁን ግን አቁሟል። አሁን መቀጠል እንችላለን። ጸጥ ብሏል አሁን።
okay now. Let's see the intermediate layers. The intermediate layer. This intermediate layer, which is erector spinae. As a group, they are called erector spinae. The erector spinae, and which extended from the sacrums, and up to the base of the craniums, and which is a chief extensors of vertebral columns, and which is found in the group between the spinous process and angles of the ribs, and which is divided into 3 columns based upon its relative size. There is laterally iliacostalis. Here it is. This one is the erector spinae, or the intermediate ones. There forms 3 columns, laterally, which is the iliacostalis ones, and next to that the intermediate one is the longismus one, and which is a small ones. There is more medially or central located one is spinalis muscles, and those muscles they also segmented into 3 parts based upon its superior attachment. For instance, there is iliacostalis muscles. This iliacostalic muscles, which has the iliacostalic lumbarums, and iliacostalis thoracis, and superiorly there is a cervicis, but there is no capitis here. Likewise, the longismus and spinalis has the same superior attachment, so which has the thoracics, cervicis, and the capitis parts, both longismus and spinalis. Okay, this one shows the classification based upon its superior attachments of the muscles. Now, the longismus and the spinalis, which is started from the thoracic region and extends up to the craniums. Therefore, there is a thoracis in the thoracic regions, in the neck region, cervicis, head, or which is capitis. The same is true in spinalis. But in the posterior abdominal, there is lumbara, which is found only on the iliacostalis one, but which extends up to the neck region, so they attach on the thoracic ones and cervicis. The name is also indicates its attachment point. Now let's see its origin and insertions of those muscles. As they originated as a command, those muscles are originated from a common point, but their insertion are different based upon the names of the muscles. Okay, they originated from the iliac crest and posterior surface of the sacrum and sacroiliac ligament. As well, from the sacral and inferior lumbar spinous process, as well as from the ligaments that run from the joint tips of the spinous process, supraspinous ligament. But this one is a common origin, but their insertions, it depends upon the types of muscles. For instance, the iliacostalis, which has 3 muscles, the lumbarum, thoracis, and cervicis. There is iliacostalis lumbarum, iliacostalis cervicis, and iliacostalis thoracis one. And their fibers are superiorly to the angles of lower ribs and cervical transverse process. Cervical transverse process. Okay. I will back. Sorry. Therefore, their insertion size is differ from types of based upon the types of muscles. For instance, the iliocostal fibers muscles, the lumbarum ones, which is inserted on the lower part, and the superior part, the thoracic and the cervicis one, which is inserted on the angles of the ribs, that means the thoracic one, and the cervicis one, which is inserted on the transverse process, That means on the transverse process there is tubericles, a tubercle, anterior and transverse, posterior tubericles. On the posterior tubercles serve as for the attachments of these muscles. And longismus, as well, there is 3 groups of longismus muscles, longismus capitis, starting from the thoracic, cervicis, and capitis. And their fibers are run, in the case of thoracic, run from superior to the ribs between tubercles and angles, angles of the ribs. Whereas in the cervicis, which is inserted on the transverse process, Whereas in the case of capitis, which is inserted on the mastoid process of temporal bones. Spinal cervicis. This one, by the way, which is a small and is not well developed like that of the longismus ones, which is runs superior to the spinous process, in the upper thoracic region, and to the craniums, because their groups of muscles are found on the thoracic, cervicis, and the capitis regions. Okay, looks these ones. This one is the iliocostalix muscles, which is more laterally, which is the lumbarum part, the iliocostalis, and this one is the iliocervicis fibers. Whereas the middle ones, the intermediate ones, the middle ones, which is the longismus ones, which has the thoracic part, the cervicis, and there is also capitis, the capitis one. And this one shows the spinals ones, which has the thoracic, the cervicis, and there is also a capitis, but those muscles are not well developed. Look, those are the transverse sections of the vertebral column that shows the positions of the muscles. Look, this is the green one, which is the superficial back muscles, and the intermediate one. They are extrinsic one. Whereas the rectus spinae, which is the intermediate one, which is found on the group between the angles of the ribs or transverse process up to the spinous process, and there is also more deep to it on the group between the spinous and transverse process, which is a deep back muscles, which is commonly called transversospinalis group. Those muscles, by the way, which is difficult to identify on the cadaver, except the multifidus, muscles. The multifidus muscle is especially developed on the inferior or lumbar regions, Otherwise, it is difficult to identify on the cadaver, on the cadavers, and which is found more deep between the group that is spinous process and transverse process. Now let's see the deep one, the deep intrinsic layer, The deep intrinsic layer, which is commonly called transversospinalis muscles, which is found in between the transverse process and the spinous process, on the group between the spinous process and transverse process, and which is deep to the erector groups, the erector spinae group. This erector spinae groups that the intermediate ones. And those muscles consist of three muscles, semispinalis, multifidus, and rotators. They originated from the transverse process of vertebrae, and they insert on the spinous process of the superior vertebra. That is why it is commonly called transverse spinalis muscles. The first names, that means the transverse, which shows the origin, whereas the last one, the spinalis, which shows the insertion. Most of the time, when the muscle that indicates the names tells its point of attachment, the origin comes first, and which is followed by their insertion. So the origin is from transverse process, and which is inserted on the spinous process. Here it is. Semispinalis ones, which is the superficial parts of the other group. Whereas there is also the intermediate one, is a multifidus, which is well developed on the lumbar regions, and this one is the only part that's easily identified in the cadavers. Whereas the more deeper ones, which is the rotator, which is run from the transverse process to the spinous process. As the name it tells, which shows the actions of the muscle. They serve as rotation, which is majorly found on the thoracic regions. And some superior parts of the lumbar regions, because rotations is mainly occur on the thoracic vertebra. There is also other deep minor muscles. For instance, there is cervical interspinae muscle. As the name it tells, it runs from the spinous process, and intertransversalis, a muscle that run from in between the transverse process. And levator costarum, which is run from the spinous process to, transverse process to the ribs. And there is also lumbar regions, interspinalis and intertransversalis muscles. Okay, and those muscles are innervated by posterior intercostal muscle. These ones, intercostal muscles are innervates this muscle, whereas the remaining other deep muscles are innervated by posterior ramus of spinal nerve. Okay. You see, this one is the multifidus, which is well developed in the lumbar regions, This one is iliac crust. So this one is the posterior views of the back. Posterior views of the back. See, this one is the spinous process of the vertebrae. Spinous process. And lateral to it, there is a multifidus muscles. Multifidus, which is well developed in these regions. The other is the rotator muscles, which is more deeper ones, which is around from the transverse process to the lamina, from transverse process to the lamina, which is mainly found on the thoracic regions, and there is also longus and brevis one, Okay. Okay. The other muscles, the interspinalis muscles that run between the spinalis, and intertransversalis, the muscles that run in between the two adjacent transverse process. Whereas levator costorum is extend from the transverse process to the ribs. And their action, which is to elevate the ribs, whereas the transversalis, which is for the lateral flexion, and the interspinalis, which is for extension. Now let's see the suboccipital one. Suboccipital regions. This suboccipital region, which is found deep to the from the back, in the cervical region, posteriorly from the cervical region, which is found under the superficial muscle, which is the trapezius, and the neck muscle, sternocleidomastoid muscle, the splenius, and semispinalis muscles, which is found deep to it. Therefore, which is the pyramidal space, which extends from the inferior occipital protuberance up to the posterior arches of C1 and C2. And which contains four muscles, and there is also neurovascular structure in this area. The muscles are, there is two rectus capitis muscles, posterior muscles, which is, there is a major and minor ones, and there is also oblique muscle, which is the superior and inferior obliquus capitis muscles. Let's see those muscles. Okay, those are the table that shows the muscle with its origin and insertion. And all of them are innervated by suboccipital nerve. Let's see the attachments of the muscle and the area. Suboccipital nerve, which is the posterior ramus of C1. Look, this one is a suboccipital region. The suboccipital region, which contain suboccipital triangles. These triangles are formed by muscles. Their boundaries are formed by muscles. Look, this one. This one is the superior and inferior and the lateral ones. The lateral boundary, which is formed by a muscle, which is a rectus capitis superior major one. The superior capitis major, and this one is the minor one. Look, the muscle first. This one is a C2 and this one is a C1. This one is the posterior arch of C1. And this one is the inferior nuchal line. And this one is the superior nuchal line, and this one is the external occipital protuberance of the occipital bone. Look then, the muscles which run from the posterior tubercles from the posterior arch of C1, which is the rectus capitis posterior major, which insert on the a medial part of the inferior iliac, inferior nuchal lines, the inferior nuchal line, which is somewhat medial. And laterally, this nuchal line is used for the insertions of the major one, the rectus capitis posterior major. And this rectus capitis posterior major, which is originated from the spinous process of C2, okay, this one is the spinous process of C2, and which is inserted on the lateral parts of the inferior nuchal line. Whereas the other two group muscles are the oblique capitis muscle. Here it is the inferior, and here it is the superior one. The inferior one, which is somewhat horizontal alignment, which is run from this one is the spinous process of C1, and this one is the transverse process of C1. Transverse process of C1. Therefore, which run from this point to this point. That means here it is. This point is the transverse process of C1 from the other side. Therefore, which is inserted on the posterior nuchal, posterior tubercles of transverse process of C1 here, and the superior one, which is originated from the posterior tubercles of transverse process of C1, and which insert to the mastoid process, somewhat medially up to the mastoid process of the temporal bone. Therefore, those muscle forms the triangle. This triangle is called sub-occipital triangle. So occipital triangle, and which contains primarily the neurovascular structure, which is the vertebral artery and sub-occipital nerve. Here it is from the other side. This one is the sub-occipital nerve, and this one is the vertebral artery. Remember, this one is the posterior atlanto-occipital membrane. You see, which is pierced by the artery, and enter to the canal, vertebral canal, and enter to the cranium, within the cranium. Therefore, which contains the two neurovascular structure, that means artery and the C1 or sub-occipital nerve, and this sub-occipital nerve which innervate the whole muscle, the four muscle. Okay. Still, it shows the triangles and the structures that contain. Now, let's continue to some clinical features of the vertebral column, If you have any questions, by the way, you can speak and ask now. Anyone who have any question, you can ask. Otherwise, let's continue to the clinical correlations of the vertebral column. Okay. The vertebral columns, fracture and dislocations of C2. Fractures of C2, which is also called axis, which is the atypical types of cervical vertebrae, because which has the odontoid process, so which is categorized under atypical one. But these bones or vertebrae are the common vertebrae that's fractured. Most of the time, even the vertebral arch are the common sites for fractures of the C2. For instance, such types of fracture which is occur on the area between intertuberculars part, which is called pars interarticularis. Pars interarticularis. That means the area in between the superior articular facet and the inferior articular facet, which is pars interarticularis. Pars interarticularis. Such types of fractures is occur when the heads are over flexed. I mean, not flexed, rather extended, like these ones, extended, which is called hyperextensions. So the fracture is occur over here, which is called hangman fractures. Hangman fractures. Remember, in such types of fractures, the heads are hyperextension over the neck. That means the necks are is not highly flexed. I mean extended. Rather the head over its the neck. Extend over the neck. For instance, in the hangman fractures, this one is the ropes. The ropes underlie on the chin, which pushes the chin posteriorly and pulls the neck anteriorly. Therefore, the heads are extended over the neck. In this case, fracture is mostly occur on this area, which is called hangman fracture. The hangman fracture. Then these types of fractures, they cause death. Because the cruciate ligament that line these structures, that means the odontoid and bodies of the situ are lined by the cruciate ligament. These cruciate ligaments are tortured, they become crushed, and they affect the spinal cord, or they apply a physical or a mechanical force over the spinal cord. So the spinal cord may be highly injured and causes a death. Now the other fracture still on the situ. Fracture may also occur on the dense odontoid process. The odontoid process, which is formed a pivot joint with that of the C1. There is a ring-like appearance posteriorly by the transverse ligament and anteriorly by the anterior arch of C1, which forms a ring-like structure, and the odontoid process is inserted on that ring-like structure. But the transverse ligament, which is more stronger than the odontoid process of C2. Therefore, during high pressures that apply on the neck, the ligament may resist that pressure, but the odontoid process which becomes fractured. But the fractures may occur at 2 points. One, it is base. That means when it attach on the bodies of the C2, or it may be fracture at the vertebral bodies of C2. This is fractures of the odontoid process. The odontoid process at the base of odontoid process, that means at the junction points of the body and the dentate process or odontoid process. In this case, this one is a transverse process. The transverse process has a chance to interpose in between the fracture, in the space between the two fractured bones. Therefore, these ligaments, they interpose the two fractured part, and in this case, reuniting the fractured structure is difficult because these ligaments interpose this fractured space. So healing process in this case is difficult because they didn't gain the fractured part of vessels, because the vessels also interposed and distorted or damaged, and they are prevented by this ligament. They will be prevented by this ligament. So those parts, they follows necrosis. The necrosis, they follows necrosis. Most of the time they follow necrosis. But in the case of such types of fracture, a fracture that is occur on the base of the C2, the healing process is somewhat faster here, faster and easy, because the transverse process is passed over here. This one is the site where transverse process are fast. Okay, opposite to is actually opposite to it. This one is the site, a facet where this the arch are, the anterior arch of C1 are articulate. And just on the level of this one, there is also a facet for the transverse process. Therefore, it doesn't interpose over the fracture, over the fracture. Therefore, it is easy to rebound or reunion with the remaining parts of the C2. Therefore, healing process here, it is easy, and they heal fastly. They heal fastly. Now let's continue to the other clinical features, which is cervical ribs. Cervical ribs. Sometimes there is a rudimentary or small superior ribs, which is suprapulmonary ribs, which is cervical ribs, which is called cervical ribs. Especially these types of ribs occur on the case of if there is fusions of vertebra, sacralization and lumbarizations, because there is shiftings of ribs towards the superior. But this ribs, which is small and rudimentary, and they apply a pressure on the neurovascular structure that exists from the thoracic aperture. The thoracic aperture, there is two aperture within the thoracic. There is the superior aperture and the inferior aperture. So the superior apertures, the neurovascular structure that exists through the superior aperture, they get a pressure from these extra ribs of cervical ribs. Specifically, the subclavian artery and the inferior trunks of the brachial plexus, they have a great chance to be compressed by these cervical ribs. Okay, the other anomaly or clinical feature is spina bifida, which is, of course, spina bifida is congenital defect. The congenital defect means that a defect that is occur before birth, a defect that occur before birth. There is spina bifida. Means that there is a failure on the fusions of the spinous process, the vertebral arch, generally the vertebral arch, which is related with the deficiency of folic acid, the mothers. For proper fusions of the vertebral arch, the vertebral arch, there is a need of efficient folic acid. But if there is deficiency of folic acid within the mother, the vertebral arch may fail to fuse properly. And those defects most of the times occur on the L5 and S1, vertebral S5 and S1, and which is also classified into spina bifida occulta and spina bifida cystica, and occluta. The spina bifida occulta, in this case, the laminas of L5 and so on which is failed to fuse. But in this case, the neurovascular structure that is found within the vertebral structure, within the vertebral column, may not be displaced from its original place. But the defects may be concealed by the overlying skin. These skins have a tuft of skin, a tuft of hair over the skin. Normally, there is no tuft of hair over the back on the vertebral column, skins of the vertebral column. But if there is spina bifida occulta, there is a tuft of hair, that is easily identified by presence of tuft of hair, because there is no bulged structure because the neurovascular structure that is found within the vertebral column is still present within the canal. Therefore, there is no any structure that can also found within the canal, but which is revealed by the presence of this hair over the skin. And more severely, the neurovascular structure, that means the vessels that supplies the spinal cord as well as the nerve, and the spinal cord itself may protrude externally and pushes the skin and forms a bulge-like appearance. In this case, which is categorized under meningocells and meningomyocele. In the case of meningocells, the membranes, that means the meninges, the spinal meninges are protruded, and there is accumulations of subarachnoid fluid, within the arachnoid space. This fluid is called CSF. But still, the spinal cord is in its position. But more severely, this one's the meningomyelocele. The spinal cord may also be displaced from its original normal position externally. In this case, there may be pins may be produced, or the trunk, inferior to it, the upper extremity and the lower extremity may be paralyzed. Okay. The spina bifida cystica. When you are saying cystica, there is protrusions of parts of the structure that is found within the vertebral columns. In this case, the structure that protrude may be that contains the meninges with the fluid, CSF fluid, or the protruded structure may also contain the spinal cord. If it is contains the spinal cord, it is also called meningomyelocele, whereas it contains only the meninges and CSF, which is called meningocele. But generally, when you are saying spina bifida cystica, there is a or a herniated structure. There is a herniated structure from the vertebral columns. Whereas in the case of spina bifida occluta, there is no structure that protrude from the vertebral canal. Now, In the meningomyelocele, that means when the spinal cords are displaced from its normal place and protrude externally, there is a paralysis of limb, and disturbance of the bladder or urinations. Urination cannot be controlled. The urination is controlled by the nerve. The nerves arise from the spinal cord. If the spinal cord which is not normal, which is not injured, they didn't give the branch that supplies the bladders. So the patients, they didn't control their urinations, and the bowels, the intestines also is not controlled, under control. Therefore, those defects is highly associated with the deficiency of folic acid, which is a supplementary for the mother, which gives us a supplementary for food when pregnant women are diagnosed their levels of folic acid, and they get a supplementary food for proper fusions of the vertebral arch, proper fusions of vertebral arch, and this meningocoele is a result of neural tube defect, which is associated with a defect closures of the neural tube during the embryonic periods of 4 up to the embryonic weeks of 4 weeks of the embryonic development. Now let's see herniations of the intervertebral disc. The intervertebral disc, the intervertebral disc, which has two parts: the nucleus pulposus and the gelatinous structure, which is found internally, and peripherally there is also annulus fibrosus. But most of the times during herniations, the central part, that means the gelatinous structure, which may be protrude posterolaterally. Therefore, if it is protrude posterolaterally, this intervertebral parts of intervertebral disc, which invaginate to the intervertebral canals, towards the canals, and they apply a pressure on the vessels and nerve. It is most of the time occur on the posterolaterally, because posterolaterally the annulus fibers are relatively thin, and the gains a support from the anterior longitudinal ligament as well. So this one is the weak area where most of the times nucleus pulposus are herniated. And regarding the regions, this nucleus pulposus is protruded or herniated in the lumbar and lumbosacral regions. Most of the times, the L4 and L5. Okay. Most of the times, the intervertebral disc, which is found in between the L4 and L5, or L5 and S1s. Has a chance to protrude most of the times, because the intervertebral discs are larger in this area, and when it is protrude, which applies a pressure on the inferior spinal nerve. For instance, For instance, if the L4 and L5 intervertebral disc, the intervertebral disc that is found in between the vertebrae L4 and L5, if it is protrude or herniated, they compress and apply a pressure on the L5 nerve, spinal nerve L5, not on L4. Okay, look this one. This one is the superior view or transverse sections of the vertebral columns. This one is the anterior one, and this one is the posterior one. So this one is the intervertebral disc. The intervertebral disc, which has two parts, peripherally the annular fibrosis, and internally there is nucleus pulposus. The nucleus pulposus part, which is a gelatinous structure, which may be protrude posterolaterally. The posterolaterally part. Towards the vertebral canal, and which compresses the nerve that is found within the canal, But the nerve, most of the superior parts of the nerve are not affected by protrusions of this intervertebral disc. Rather, the inferior nerve are the nerve that is compressed, have a great chance to be compressed. Look this ones. For instance, this one is intervertebral disc in between. This one is L4, and this one is L5. Therefore, if it is protrude, which compresses the nerve that exists from the inferior intervertebral foramen. You see, those nerves has a great chance to be compressed by herniations of this one. Mind you here, the L4 which exists superior to it, so they didn't compressed by herniations of this intervertebral disc. Okay, but the degrees of compressions of the nerve is also related with the degrees of the amounts of the nucleus pulposus part that protrude towards the vertebral column. So it may be compressed from both sides, all of the nerve that is found inferior to it, or some of the nerve, especially from one side. Okay, it determines degrees of herniation. Now the other is lumbar puncture. The lumbar puncture. Lumbar punctures means that tappings of the subarachnoid space in the lumbar regions, which is used for diagnostic purpose or for medications to introduce anesthesia or drug, or it may be radiopack materials also incorporated into the subarachnoid space by lumbar puncture. Now, the lumbar puncture most of the time is occur on the in between L3 and L4, or below that L4 and 5. Because in these regions, the lumbar regions which is called lumbar cisternae, because the subarachnoid space here, it is more larger, more wider. The subarachnoid space are wider, so which is called lumbar cisternae. Okay, and to perform the lumbar puncture, the patient should be flexed laterally in this position, like in these positions. Okay, when it is flexed, the space between the arches of the consecutive vertebrae are increased. So you see, so it's allow for the passage of the syringe the passage of the syringe. So it can access the subarachnoid space easily. The subarachnoid space easily. Okay. I think this one is the end slide. The end slide. And this lumbar puncture takes place between L3 and L4 and L4 and L5. L4 and L5. And sometimes it may be occur on L5 and S1. L5 and S1. But most of the time which is occur on the L3 and L4 and L4 and L5. Okay. Okay. I think this is the end of our sessions. If you have any questions, you're welcome.
ይሰማል ቻል?
Yes,
ጥያቄ ነበረኝ ትናንትና ከተማርነው እና ቫሪዬሽን አለ አይደል? ቨርተብሬ ቫሪዬሽን አለና ሳክራላይዜሽን ላይ L5 ሳክራላይዝድ ይሆናል አይደለ?
Yes.
ሳክራላይዝድ ይሆናል። ከዛ ስትሮንግ ስለሚሆን የሆነ ካይንድ ኦፍ እንትን ፔንፉል ሲምፕተም ምናምን አለው የሚል ነገር አለ አይደል?
ኦኬ ሳክራላይዝድ ሲሆን
ከዛ ግን ሰርቪካል ሪብ C7 ላይ T1 ትኖራለች ማለት እዚህ ጋር ሳክራላይዝድ ስለሆነ L4 ስለሚሆን የሉምባር ቨርተብሬት ፎርስ ስለሚሆን T1 C7 ላይ ሰርቪካል ሪብ ላይ ሄዳ አታች ታደርጋለች ይችላልና አንደኛ C7 ሱፔሪየር ኮስታል ፋሴት አለው ወይ ላይክ ሪቡ ሂዶ ጆይን እንዲያደርግ ሱፔሪየር ኮስታል ፋሴት ያስፈልገዋል አይደል?
Yes.
C7 ደግሞ
የለውም
እና እንዴት ነው
ይሄ እኮ አብኖርማል ነው። ኦኬ this one is abnormal ሲጀመር ኖርማሊ 12 ቶራስ ተብሪዎች ሪብሶች ቶራስ ላይ አሉ ግን ሽፍት የሚያደርገው አዲሽናል ነው ያ ማለት 13ኛ ሪብስ አለ ማለት ነው በሌላ አባባል ይሄ ደግሞ አብኖርማል ስለሆነ እስከሆነ ድረስ ኖሮ አልኖረው እንትናት ሚስቴክ የሚፈጠር ስለሆነ ማለት ነው
Look at the math general pumping that stomach is risky. What's the name?
ጥያቄ የሌላችሁ ሞት አርጉ ጥያቄ ያላችሁ መጠየቅ ትችላላችሁ አንሞት እያደረጋችሁ ወይንም የእጅ ምልክት ማውጣት ትችላላችሁ እጅ ምልክት ነበር ሳ
You're not gonna ask me if you got home.
You have a question? If you have any questions, you're welcome. Otherwise, make mute.